Hi, Ashley Tharp. Show you my ID. Perfect. Moving on around the room. That's just a list of what's in the drawers for this cart. Has nothing to do with our exam. Snelling. Same thing. This is paperwork and tools that I need for the exam. Vitals, clock face, Rosenberg, Rosenbaum, and on around. I also have my cell phone taping just in case this doesn't work on the camera. I ran into trouble last time. Okay, so moving on with the exam. Hi, my name's Ashley. I'm going to be taking care of you. Can you tell me your name, date of birth?
Corey Tharp, 5/13/88.
All right, Mr. Tharp, how old are you?
I am 33 years old.
Okay, perfect. And how'd you get here today?
I drove myself.
Awesome. Any trouble with driving?
No, ma'am.
Any trouble with vision?
No, ma'am.
Not vision, double vision? Okay,
No.
perfect. What are you here for today?
I'm just here for a wellness exam.
Okay, awesome. So right off the bat, I noticed that head is in midline. It's normocephalic. I see no obvious lesions, sores, or broken areas. I'm going to touch you.
Okay.
Skin turgor is good. It's less than 3 seconds. Skin is warm, dry, and intact. I do see a couple of areas where you look like you have some scars.
Yeah.
Moving on, I am going to palpate your head. Okay, do you have any pain or tenderness there?
No.
Okay, and I'm short, so I have to step up on
It's
this.
okay.
I'm so sorry. All right, when I inspect the hair, it's evenly distributed, dark brown, and it's soft. I see no balding spots, no lice infestations, no lesions. Receding hairline is not there, so his hairline is good and normal. I'm going to touch and feel inside there. I feel no opened areas. Perfect. While I'm back here, I'm going to go ahead and massage and check your occipital lymph node. Any pain or tenderness?
No.
Okay. I'm going to mash on your frontal sinus. Any pain?
Okay.
Ethmoid? Any pain?
Nope.
Maxillary? Any pain?
No.
Perfect. Okay. Moving on. I see that the eyes are evenly and equal bilaterally. The ears are anatomically correct in the position. I don't see any redness. I don't see any swelling. Have you had any pain or issue?
No.
Okay. Since I already have my otoscope here, I'm going to move on and do your ears first. Okay. And what I'm going to look for is I'm looking at the external ear. I don't see any redness, no erythema, no swelling, no drainage. Have you had any drainage?
No.
Back behind your ear looks great. I see no crusty skin and no lesions. Any pain?
No.
Perfect. I'm going to pull up and back. I'm going to insert the otoscope, and it's going to be a little, lean towards me just a little bit. A little bit of pressure. Okay, perfect. I see your tympanic membrane. A little bit of earwax. The internal canal looks good. I don't see any redness. I didn't see any bulging of the membrane. And I can visualize the processes within the ear. On this side, same thing. Pain?
No pain.
I see no lesions, no opened areas. Push up and back, just lean towards me just a little. All right. Awesome. Looks great. This one has a little bit more wax.
Okay.
So while I'm over here, I'm going to test the whisper test. So I'm actually going to include this ear, and I want you to tell me what word I say. Cat.
Cat.
Okay. All right, and I'm going to go to this side. Let's go to whisper with the whisper test.
Dog.
Perfect. Okay. Also, while I'm back here behind you, I'm going to check. Will you let me know when you see my fingers?
No.
Okay.
No.
Perfect.
No.
Perfect. Again?
No. No. No.
Perfect. All right. I'm going to do the Weber test. So I'm going to strike the hammer. Let me know if you feel it equally in both ears.
I do.
Perfect. So equal lateralization. I'm going to strike this and put it on the bony prominence behind your ear. Tell me when you stop feeling it.
Okay.
Okay? And when you stop hearing it.
Okay.
Perfect. So, air conduction was better than bone conduction, which is the way that we want it to be. So that was normal and intact. Same thing on this side.
Okay. Okay.
Both of those are equally bilateral. So that actually just tested your cranial nerve 8, and that was intact. I didn't see any issues with that. So we'll move on to the eyes. And as I'm loading up my ophthalmoscope, you'll take a look at the Snellen chart back there and tell me the lowest line that you see.
DEFPOTEC.
Okay, cover your left eye and read off the same lowest line you can see.
DEFPOTEC.
Okay, and then the right eye.
DEFPOTEC.
Perfect, that's 20/20. Same process, but I want you to read the lowest line that you can read.
374258.
Okay, and cover an eye and repeat it.
374258.
All right, and the other side.
374258.
Awesome. So that was 20/30. Now you've had corrective eye surgery.
I have.
Okay, that was about 1.5 years ago.
Yep.
All right, perfect. Have you had any issues or concerns since the surgery?
Only issues was dry.
Okay, dry. Was that made worse, or was that about the same before?
Worse. I didn't have dry before surgery.
Okay. All right. So, one thing I would recommend using is lubricating eye drops for the eye.
I do. I use Blink.
Perfect.
Yeah.
That's exactly what I would. It's a great one to actually recommend. And then the other thing I would tell you to kind of watch for is when we have dry, itchy eyes, oftentimes we'll catch ourselves wanting to kind of rub or scratch our eye, and I would tell you not to do that because it can cause abrasions and irritation to the eye, especially a person like you who's had corrective laser surgery. Okay, so I want you, before I do this, follow my finger with your eyes only. Don't move your head. Perfect. Perfect. So no extraocular eye movements noted, known as sagmus. That actually tested your cranial nerves 3, 4, and 6. Now if you'll just look straight ahead, actually come a little bit behind me, I'm going to shine a bright light in your eye, and I want to see that your eyes accommodate. Perfect. Perfect. Okay. So that would be what we consider perla. Your eyes were, pupils were equal, round, and reacted to light accordingly. Just look at me. The pupil size is good. It's about a 2 to 3, maybe 3. I'm going to pull down on your eyelid. Your conjunctiva looks good in pink. I don't see any redness. I don't see any nodules. Same thing on the top. The sclera is good in white. And then I noticed too with your eyes that I got the hair evenly distributed. Your eyes are closing down and your eyelashes are covering while you blink. I don't see any crustaceans, lesions, nodules in your eyes or your eyelids. Does that hurt any?
No.
Black enamel duck is soft. All right, now I have to get a little personal in your personal space, okay? So just look back behind me. Fix your eye. All right. All right, optic disc looks great. I see no red reflex. Vasculature on both eyes look fantastic. I don't see any hemorrhages. I don't see any cotton wools, which would make me think of degenerative eye disease. And I could visualize your optic disc very, very, very well. It had clean margins. I know it kind of messes with the eye a little bit. I'm sorry.
No,
the next thing I'm going to have you do is go ahead and close your eyes, and I'm going to touch you with something soft and something sharp. For a point of reference, it's a sharp, that's soft. Okay? You tell me what you feel.
Soft. Sharp. Soft. Sharp.
Perfect. Go ahead.
Soft. Sharp.
Perfect.
Soft. Sharp. Sharp. Sharp.
Perfect.
Sharp. Soft. Soft. Sharp. Soft. Sharp.
Perfect. You have sensation all through your face and your extremities. When I'm looking at the face, one of the things I was testing for is your cranial nerve 5, trigeminal, and that was perfect. It was intact. The other thing is I would like for you to raise your eyebrows. Perfect. Smile, showing your teeth. Great. Can you puff out your cheeks? All right. Can you frown? Good. All right. And can you whistle? Good. So cranial nerve 7 is intact. I'm going to look in your nose.
Okay.
I do see a slight deviation to the right, and that was from a sports injury,
It was
correct?
in high school.
Okay. Have you had any trouble with the patency of your nose?
No.
All right. Any snoring?
No.
All right. While I'm doing this, if you will cover one ears and take a deep breath. All right, and the other side. Perfect. All right. While you do that, close your eyes. And I want you to plug one side of your nose. There we go. And I want you to tell me what you smell.
It's minty, like almost like peppermint.
Okay, good. On the other side.
Same exact thing.
Okay, perfect. That's exactly what it was. It's peppermint essential oil. All right, so that was testing your optic nerve, or your cranial nerve 1, the optic nerve, or olfactory. I'm getting tongue-tied today. All right, just lean back. I noticed that the nose is midline. There's a slight deviation to the right. The external nares look patent, a little slightly less patent on that left side as it deviates to the right. But the turbinates look great. Nice pink color. Yes, no perforations. I see no sores or lesions and no drainage. That looks great. The internal, so even though it looks a little occluded right here, it's actually pretty free up there. So
Good.
That's great. So the next thing I'm going to do is I'm going to have you stick your tongue out as far as you can. Perfect. Lift it up. All right. Move it side to side. All right. Can you stick it to the side of your mouth with your mouth closed on each side? Perfect. Perfect. All right. I'm going to assess your mouth. And just looking at the external portion of your mouth, it's uniformed. It is symmetrical. I don't see any side that's lagging. The lips look good and healthy. I don't see any chapped lips or cracked lips. No bleeding noted. If you will just open up your mouth and say ah. All right. And again. Okay. Gag reflex is intact. Right down just a little bit. There we go. Uvula, say ah again. Good. Uvula moves up to midline. It does not move away from one side or the other. It doesn't deviate from one side or the other. Okay. Just, I'm looking at the buccal mucosa. It's nice and pink. No lesions. No sores. Let your tongue up again. All right, I don't feel any stones, nodules, or sores there. Stick the tongue out one more time. Great. No atrophy, no fissures. It's midline. That looks great. You can close your mouth. When I was looking at the dentation, you've got pretty teeth. They're nice and white. I have noticed that you do have 3 missing. And I also noticed that the gum line is a little irritated. So I'd say that might be from over aggressive brushing. Try not to go side to side, but more in a circular motion gently. And then you can also follow that up with going downwards and kind of stroking your gums down. That will help keep from it atrophy and causing irritation. So flossing helps too. All right. So the next thing I'm going to have you do, I checked your cranial nerve 9 and 10 right there, and then I'm going to have you take a drink. 9, 10, and 12 actually. So I want you to take a drink, hold it in your mouth, don't swallow until I tell you.
Okay.
Okay. Palpate your thyroid and go ahead and swallow. Great. So it's midline. See no deviations. Thyroid was palpated without any nodules or lobes enlarged. Okay. Moving on. Shrug against my hands. Perfect. Cranial nerve 11 is in place. So we have now checked cranial nerve 1 through 12 in the head portion of this exam. Moving on, I'm going to move this pillow out from behind you for just a second and kind of lower this bed just a little bit. I want to look at your back. Okay. So, as I'm looking at the respiratory portion of this, I'm looking at the breathing, at the symmetry. There's no asymmetry noted. I don't see any lumps, nodules, or lesions on the anterior chest or the posterior chest. When I'm touching, is there any pain?
No pain.
Okay. Can you say 99?
99.
99?
99.
99?
99.
99?
99. 99.
Okay.
99.
Perfect. Now, any pain here? C1 or C7, I mean?
No.
C7 through T1?
No.
No. I'm going to run down your back. Any pain in that spiny process?
No.
Okay. I'm going to do your diaphragmatic excursion. Just take a good deep breath. Perfect. The contour of the chest is not barreled, and I don't see any concave areas. This looks good. Good AP width, the transverse width. Then to percuss. Should be resonance. Perfect. All right. While I'm back here, I'm going to check for CVA tenderness, okay? Any tenderness?
Nope.
Perfect.
Nope.
Now I'm going to listen to it, and I'm going to listen to it once through, just normal breathing, good deep breaths, and then I'm going to have you say E, okay? But I'll tell you when. Good deep breath. Perfect. Okay, say E.
E. E.
Good.
E.
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 Good.
E.
Good.
E.
Good.
E.
Perfect. Okay. From here, go ahead and say E.
E. E. E. E. E. E.
Perfect. Okay. And while I'm here on the chest, I'll go ahead and listen too. So, tactile fremitus was felt when we said 99, and then E is for the egophony, egophony, and that was heard throughout the lung bases, so no consolidation was there. Okay, deep breath. Good job. Good job. Okay. Good. Okay. While I'm here, I'm going to go ahead and listen to your heart. Okay? Does it bother you if I talk to you as I'm doing this?
No.
Okay. So, just normal breathing in and out. Listen to the aortic, pulmonic, tricuspid, mitral. All right. S1 and S2 heard without gallops or clicks. Now I'm listening to it, the bell for murmurs, aortic, pulmonic, tricuspid, and mitral. No murmurs or bruits heard. I'll go ahead and feel for your carotid. Good, strong +2. Call it regular rhythm. Take a deep breath and hold it. Okay, no buoys heard. No buoys heard. Okay, temporal pulse is good. Strong, let's call it a +2. No buoys heard. Okay, perfect. All right. I'm going to still percuss this chest. That's great. All right. So I'm going to have you lay back for me. There we go. Okay. What I'm going to do is I'm going to shine a light on your neck, and I want you to turn that way, and I'm looking for jugular vein distension, and I don't see any. Perfect, okay? Try to keep you covered. The dark. I'm going to raise your gown up, and I'm looking at your abdomen. So I notice that there's no lumps or lesions or nodules that is visibly seen at this point. It is round contour. Skin is evenly distributed with the nice pink color. Breast tissue is typical for your sexual maturation and age. No pain.
No pain.
Okay. Any pain up here?
No pain.
Okay.
No pain.
Pain? Okay, good. So no lymph node involvement in the axillary. All right, I'm going to listen to your stomach. Good bowel sounds. Healthy bowel sounds, active in all 4 quadrants, not hypo or hyper, soft tinkling heard. I'm going to go ahead and assess the aorta, renal, iliac, and femoral arteries for breweries, okay?
Okay.
And heard in the aorta, renal, the breweries, the iliac, the breweries, femoral. No breweries. Perfect. Okay, now I'm going to percuss over your abdomen. It should kind of sound like a little hollow drum. Tympanic. Hear the difference?
Mm-hmm.
So that's over your stomach, which is filled with air, and your intestine. This is your liver. Okay, and the bladder. Good. You've emptied your bladder before we started this. Oftentimes over organs, it'll sound dull. So take a good deep breath in. I'm going to feel for I'm going to palpate lightly first. You let me know if there's any pain.
No pain.
Okay, I'm going to feel a little deeper. Pain.
No pain. No pain.
Okay. I feel for the kidneys. Awesome. Side. Nothing.
No pain.
Okay. I'm also going to feel for the spleen. Take a good deep breath in. All right, that's great. And then on this side for the liver. Deep breath in. Perfect. Okay. So I've percussed the liver a little bit. Okay. So liver span appears normal. I'd say it's about 7 to 8 centimeters, which is exactly where we want it to be. Okay. Going to go ahead and look at your lower legs, if that's okay with you. Again, I'll keep you covered. So I'd already checked for the sensation in all lower extremities, and you had that. That was fantastic. And I look, and this color is even uniformed. It's a nice skin color. I see very little to no redness, no edema, no blue color or discolorations. Skin turgor is good in less than 3 seconds. Capillary refill is great. Okay, on here I'll feel for your dorsal pulse. That's good and strong. It's good and strong. Got good strong pulses in your feet. Okay, any trouble with range of motion? All right, just wiggle your legs, your feet around for me. Can you flex them and then hyperextend them? Perfect. All right, I'm going to check for clonus. No beats of clonus noted. No beats of clonus noted. Perfect. All right, I'm going to push this exam tool if I can and help you sit up. All right, perfect. Is that comfortable? Mm-hmm. Okay. So when feet are hanging down, it didn't change in any color. It still looks great and uniformed. One thing I forgot to... Oh, I did it. I just swallowed. Okay, I'm going to check your reflexes. So, +2. +2 on your radial, +2, that was your popliteal that I checked, +2, brachial, good movement, +2, 2, perfect. All right. I'm going to give you a series of 3 words.
Okay.
I want you to commit them to memory because I'm going to ask you them again, okay? So repeat after me. Banana.
Banana.
Chair.
Chair.
Sunrise.
Sunrise.
Perfect. Okay. So now we're going to do range of motion. And actually, I should lay you back down. I'm so sorry.
It's okay.
I try not to do that. Okay. Going to raise your leg up. In. Any pain?
No pain.
Out. To the side. Pain?
Nothing.
Okay. On the other side, can you do that on your own? Up. Flex. Perfect. Extend back out. To the side. Perfect. No pain.
No pain.
Okay. Now I can set you up. It's going to come up as easy as the other. All right. Any questions so far about what we've done?
No questions.
Okay. I'm going to test the vibration on both extremities. You feel it?
I feel that.
Good. And again?
I feel that.
Perfect. Okay. Now, with your eyes closed, tell me if your big toe is up or down.
Up. Down. Down. Up.
Perfect. Okay. Stick your arms straight out. Raise them up, down. And raise one to the side. Okay. And back down. And the other side. Perfect. Any trouble with range of motion there? No. Didn't hear any clicking. Did you feel any?
Mm-mm.
Okay. Perfect. With your head, I want you to flex, extend, upper flex, back to extend, side, lateral, to the other side, and then try to touch your ear to your shoulder, the other side. Perfect. Any trouble?
No.
All right. I'm going to check your resistance to strengthen your lower extremities. Okay. So try to push your legs up off the bed. Perfect. Good, strong. That's a 5. Push against my hand. Good, strong. 5. Pull against. Good. That's good and strong. That's all a 5. Push. Perfect. Pull. Perfect. Good, strong. 5. All right. Hands. Put your hands straight out. Can you make a fist? Really tight? Good. Can you rotate them side to side really fast? Can you put them on your laps and do that? Fast. Good. All right. Actually, I'm going to have you, sorry, flex, extend, hyperflex. Perfect. While you're there, try to push against me. Good. Good, strong 5. And up. Good. And again. Perfect. Perfect. Good, strong arms. So I'm going to push against you. Raise. Good. And try not to. Perfect. Good, strong 5. So all the strength in your upper and lower body is all symmetrical. It was good and strong and equal. So I would actually rate that as a 5. That's great. You had great reflexes. They were +2, right in that normal range. No discolorations in your feet or your legs. The vasculature looks good. There's good blood flow. So at this point, have you had any other issues? Any trouble? Well, one thing that we're not going to assess here today, but that we would normally assess, is the genital and anal area. Have you had any issues?
No
with
issues
that?
whatsoever.
No issues with blood flow or impotence or no incontinence or leaking.
No.
And no discharge from the penis.
No.
Okay. No lesions.
Nothing.
Okay. So I'm going to ask you, what is your name?
Corey. Tharp.
Date of birth?
5/13/88.
And what year is it?
2021.
Who's our president?
Joe Biden.
All right, perfect. Do you know where you're at?
King's Daughters Medical Center.
For what?
For a wellness exam.
Awesome. Okay, so you're awake, alert, and oriented × 3. You know where you are. I'm actually going to test you and have you draw a clock for me.
Okay.
We have to do this pretty quickly, so just write the numbers in. And then after you get those on there, I will tell you what our next step is. Okay, as you complete the numbers, I want you to put the hands of the clock at 1:25. And that is perfect. All right, can you tell me those 3 words?
Banana, chair, sunrise.
Awesome. Okay. Well, I think that concludes our head-to-toe assessment. Didn't see anything. I mean, it's pretty unremarkable. I didn't see any really striking abnormalities. One thing I forgot to do real quick, if you don't care, is I'm going to palpate this angle of obliquity. And I'm looking for heaves, thrills, and I don't feel any. That's great. And I'm going to also go up here to the module. And that is point impulse. Great, no heaves or thrills. All right, so to conclude, I'm also going to go over your vitals with you. Because I kind of got started and didn't go over it with you, but my nurse had gotten it before I came in. And I had a glance at them, so that's probably why I forgot to mention them, because they all looked pretty good. The only thing that I think that we should address is the blood pressure. And it's just slightly. It's actually at the cutoff point for hypertension. So 128/80. Everything else looked good. No fever. Pulse was good. Your respirations were great at 18. Your oxygen level is 100% room air. You can't get any better than that. And you've had no pain. So what I want you to do for me, especially since you have a pretty significant family history of cardiovascular disease and hypertension, I want you to watch that blood pressure. Because this may just be a one-time thing where you're here in the office and kind of anxious, and that gets the blood pressure up. But just a couple of times a week, kind of spot check it. Try to keep it at the consistent same time of the day. And then just see if it's elevated. If it's running elevated, I want you to contact me. We'll get you in. We'll do some more workup. Okay. So any questions about hypertension?
No questions.
Normal range would be anything less than 128/80. Okay. So other than that, I think we're done. All your cranial nerves were intact. Your neuro exam was great. I need to do your walking. We'll do that really quick. Okay. If you don't
You
mind,
need me to stand up?
yes, please stand up for me. And sit down here. I'm going to move. If you'll just bend forward and try to touch your toes. Awesome. Stand back up. I see no curvature of the spine. This all looked great. If you will walk heel toe in front of me. Good, even gait. Awesome. Perfect. Okay. If you'll stand right here, close your eyes. Doing the Romberg test. I'm looking for any swaying. Don't see any. Okay, raise your arms up. Looking for pronator drift for about 10 seconds. All right, perfect. Okay. One last thing is hyperextend. Perfect. Any pain with that?
No pain.
No change in range of motion. Okay, have a seat for me.
Okay.
Okay, so just to conclude, sorry.
No, it's okay.
Sorry about that. Your vitals were good. We're going to watch the blood pressure.
Okay.
We are also going to continue using the blink eye drops.
Okay.
And try not to rub the eyes to cause any irritation. Physical exam was pretty unremarkable. Everything looked great. Ears were great. No redness, no drainage, no redness inside the internal canal. The nose looked great. No drainage there. Turbinate's pink. Mouth looked fantastic. Good teeth. No oral lesions. You had no trouble with any of your cranial nerves. They were all intact, 1 through 12. And heart sounded fantastic. S1, S2 was heard without any clicks or extra beats. And no friction rubs, no murmurs, no breweries. Carotid's good and strong. Temporal arteries good and strong. No breweries heard in your abdomen. For your aorta, renal, iliac, or femoral arteries, you have good range of motion everywhere in your body, and your lungs sounded fantastic. There was no adventitious sounds heard, so there's no crackles, no wheezes. It was good and even. Breath sounds were good and clear. Bowels were great. Very soft tinkling, just normal active in all 4 quadrants. There's no pain on deep palpation. Liver span was within normal range. So overall color good of you. Your overall color is good. Even gait. I didn't see any neurological deficits. So if you don't have any questions, that pretty much concludes our exam.
Yeah.
Awesome.
Yeah.
So we will have you follow back up just for a spot check on that blood pressure in about a month, okay?
Okay.
All right. It's a pleasure taking care of you. If you need anything, our number's on that paperwork.
Okay.
Feel free to give us a call before then, okay?
Will do.
All right. Have a great day. Oh, it didn't.